Hello, my name is Mackenzie Clements.
Brianna Barker.
Emily Masters.
Hi, I'm Ashley Molson.
And this is the speech language pathologist role in the NICU. A quick overview of an SLP in the NICU. Approximately 10 to 15% of all infants born in the United States are admitted into the NICU. A neonate's ability to gain weight after birth is reliant on their ability to feed, which can be supported by speech language pathologists. Weight gain has been proven to be a predicting factor in preventing future complications. The role of a NICU speech language pathologist is that they are experts in diagnostic matters. They should understand normal childhood development processes, and they should provide education, counseling, and support to families and other caregivers and staff regarding preferred practices in the NICU to support current and future communication, cognition, feeding, and swallowing skills. Basic competencies of speech pathologists in the NICU are that they should have basic knowledge to aid in serving the NICU population. They should have skills that are culturally appropriate, team-based, family-centered, and ecologically based. They should assess and intervene in practices that are developmentally appropriate, and they should have extensive knowledge in a variety of areas and subjects relating to the NICU. Speech pathologists should have knowledge in normal embryology, perinatal and postnatal development, atypical infant development, family-centered practices, team-based processes, foundations of developmentally supportive care, medical complications impacting infants, medical equipment and procedures used in the NICU, NICU staffing patterns, ecology in the NICU, and parenting in the NICU. For communication and swallowing or feeding evaluations, speech pathologists should be able to identify infants at risk for developmental communication, cognition, feeding, and swallowing problems.
All right, and to go a little bit more in depth about the feeding and swallowing examinations that SLPs do, SLPs identify an infant's risk for certain problems, and to do this, they must understand the embryology, the anatomy, the physiology, the behavioral organization, infant communication, how infants can communicate, the risks that are associated with certain medical conditions that are commonly found in infants in the NICU, the etiology of those certain medical conditions that are common, the processes that are associated with infant feeding and swallowing, the cognition skills that an infant has, and then their self-regulation skills. All right, SLPs also are able to conduct clinical assessments of infants and family for communication, cognition, feeding, and swallowing problems. And this can include neurodevelopmental assessments. So in order to do that, they must also understand the embryology, anatomy, and physiology of infants in the NICU. They need to understand various oral and non-oral feeding methods. They need to understand the appropriate assessment tools that are needed for each assessment and when it's appropriate to use each of the tools. They need to know how to provide appropriate documentation so that they can write about what assessments were given and the results of the assessments at the end. They need to know how to interpret assessment findings. They need to know about cervical osculation, which is when you use a stethoscope to listen to their swallowing. They need to understand the criteria for determining the need of referrals. And they also need to understand the normal and abnormal structure and function of all of the anatomy that's needed for swallowing. All right, so the knowledge that is needed by a NICU SLP when determining evaluations for feeding and swallowing of infants. SLPs need to know the existing instrumental techniques that are available. Just like we talked about a little bit ago, the cervical osculation, the variability and developmental progression of swallowing behaviors in the preterm infants. They also need to know the techniques used for the modification of swallowing behaviors and they need to be able to provide concise, thorough, and objective documentation. Okay, and then some of the assessment procedures that we'll go into. When assessing infants within the NICU, this involves looking at their ability to latch and transfer fluid through the oral cavity and their ability to manage fluid in the throat for safe swallowing.
So to conduct a swallowing assessment, there are various mechanisms that are involved in swallowing that speech pathologists assess during evaluations. Some of these major mechanisms include the velum, esophagus, esophageal sphincter, and the tongue. Speech-language pathologists commonly use modified barium swallow studies to evaluate the mechanisms of swallowing by adding barium dye to substances in which the infants swallow. And if any of the substance is swallowed incorrectly, the X-rays will allow us to assess which swallowing mechanisms are not working properly. This is a picture that displays a lateral X-ray view of an infant during a modified barium swallow study. It allows the speech pathologist to see the bolus travel from the infant's mouth to their stomach and where the bolus could get lost along the way. For feeding and swallowing evaluations, the skills that are needed for a NICU SLP are that they should be able to identify appropriate testing resources. They should be able to recommend appropriate instrumentation techniques. They should also be able to perform appropriate instrumental assessments and interpret instrumental assessments. They also need to be able to document and communicate findings and recommendations with caregivers and the NICU team in a concise, thorough, and objective manner.
Communication and feeding and swallowing interventions. An SLP provides support and interventions / treatments to infants for communication, cognition, feeding, and swallowing problems. SLPs also implement strategies and techniques to improve the latch, suction, and fluid flow rates. So for an SLP to provide support and interventions, SLP must know the following: development of sensory systems, the development of infant sensory competencies, strategies to facilitate parent-infant interactions, existing intervention procedures, syntactic systems of behavioral organization, developmental acquisition and developmental sequencing and acquisition of pre-verbal auditory development, document procedures, ethnic and quality of life concerns, oral, visual, non-oral intake methods, and status of various grammatic, medical, and surgical conditions. Communication and feeding swallowing interventions. As we continue, the SLP provides supports, interventions, and treatments for infants regarding communication, feeding, and swallowing, identifying risk factors of aspiration and a funnel physiological compromise to recommended and implement appropriate precautions. Implement intervention strategies for infants, medical and surgical conditions, behavioral status, and swallowing safety and competencies, and provide developmentally appropriate and family-centered care.
Moving on to caregiver education and counseling and staff education. SLPs in the NICU collaborate with other team members in identifying the needs for additional assessments and consultations. In addition to that, they collaborate with the family and other team members regarding management decisions for care of the infant and family. For knowledge needed as a NICU SLP when providing caregiver education and counseling, the SLPs must be knowledgeable of the implications of the infant's condition and the family concerns as they relate to the need for additional information to resolve issues of comprehensive care. SLPs must have knowledge in models of collaborative team-based decision-making, and they must also understand and have knowledge of the techniques or processes in effective facilitation and maintenance of team communication and interaction. The data and procedures that are needed to support SLP's participation as an integral member of the NICU team, and this includes cost accounting and productivity factors. And they must have knowledge of the impacts of cultural beliefs, values, and practices on team interactions. The skills needed for caregiver education and counseling: they must participate with other professionals in interpreting information and planning culturally appropriate interventions and identifying core members and supportive services. In addition, they demonstrate use of a solution-focused approach to resolution of differences and conflicts among team members. So this concludes our in-service topic today. Thank you for listening to us. We hope you found this to be informational and gain better insight into the role SLPs have in the NICU.